our nation's top doctors, veterans and homeless advocates, and much of the U.S. public agree. America is in a mental health crisis.
We need more psychologists, psychiatrists, counselors, therapists, etc.
So now the United States Senate is joining the growing chorus and coming together, launching the first of its kind mental health caucus, a sign that the issue has come a long way.
It's not a red state, blue state thing.
It's a personal thing. Senators from both sides of the aisle are opening up with the hope of propelling change.
I was on medication that caused me for a period of time to have manic behavior. So I got a glimpse of what it feels like to be bipolar.
When I was in college, and then again when I was a young mom, I struggled with depression.
4 years ago, during her first speech on the Senate floor, Tina Smith shared her harrowing and all too common mental health story.
So that's my story, but really it's the story of millions of Americans.
It sparked a national conversation. Rarely had such a high-profile figure, a member of government, been so vulnerable.
Then I realized that there's a lot of power in people who are powerful and by all appearances have everything all together in their lives to be able to be really direct about some of the challenges that we face.
From ending stigma to taking action, Smith joining Democrat Alex Padilla and Republican Senators Tom Tillis and Joni Ernst in starting the group, all bringing their own experiences to the forefront.
First of all, we're talking, and it's something that doesn't happen enough.
The California Democrat's wife, Angela, dedicated her career to educating others on mental health after spending her life taking care of her mom, diagnosed with bipolar and schizoaffective disorder.
Because as severe as that diagnosis is, the family has really rallied around her, and as a result, she's actually led a pretty fulfilling life.
From parents to veterans to the classroom, millions are impacted by mental trauma.
The need for care and access to care has skyrocketed over the last few years, and so many people are struggling in finding it.
Each year, 1 in 5 adults experience mental illness. By age 14, half of all lifetime mental illness begins. Among 10 to 14-year-olds, suicide is the second leading cause of death. In the wake of the Uvalde mass shooting last year that left 19 children and 2 teachers dead, the senators crafted a bill investing in mental health resources nationwide. Now, a law, it provides $245 million to fund mental health support around the country.
What's your first action going to be in this caucus?
Short term, we have a tremendous opportunity with the resources made available in the Safer Communities Act.
Yeah, that's the foundation upon which I think so many other things can be built.
The lawmakers emphasizing the need for more education and training so that every American in crisis can feel a sense of community.
Once upon a time, people were very hesitant, scared to share a diabetes diagnosis. So I'm eager for the day where talking about mental health, it's normal conversation.
And Julie Tsirkin joins us now. I got to say, I'm glad that some of the stigma is now finally being erased. This caucus is really looking at the big picture, but as you reported, it was born out of yet another mass shooting. How do the senators you talk to think that addressing mental health will help in curb violence?
Well, Tom, it probably won't surprise you to learn that I spoke to several Republicans yesterday since the shooting in Maine, and they told me that they really believe that this is not a gun issue, that this is a mental health issue. But when you look at the Bipartisan Safer Communities Act, that gun bill that we were talking to Senators Padilla and Tillis about, Senator Graham, by the way, who you heard from in the beginning, he also played a part in that. They expanded resources for red flag laws. That is something we know Maine did not have, having a narrow or yellow flag law. And you can be sure that the bipartisan group will continue to look at this issue from the lens of gun safety when they meet, when they start working as a group. This is definitely an issue that's not going to go away. As Padilla and Tillis told me, that was just a down payment on the issue. They plan to do a lot more.
It's important to remember that every country has mental illness. Very few countries have the level of violence, gun violence, we do. But Julie, thank you very much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.